Paul Harrell, weekdays from 4 to 6. Learn more at paulharrell.com. Media Group.
Hey, folks, welcome. Hour number 2 here. Thank you so much for being with us. My name is Paul. You have found the intersection of conservative ideas and reality, where we are building a liberty machine. Welcome back to the program. A senator calling in from North Central Arkansas, Senator Scott Flippo, is back with us. Scott, welcome, sir.
Paul, thank you. Pleasure to be with you all.
As always, sir. How was your 4th of July, by the way?
It was great. It was actually fairly uneventful. Didn't make it on the lake, but I did get some yard work done and got to clear out my flower beds and do a little bit of mulching. And so the signs that you're getting older is you look forward to holidays, not because you're going to be on the lake or the river, but because it's going to provide you with a day that you can get outside and work in your yard.
Yeah. Yeah, you're exactly right. That's exactly true. Signs that you're getting older. Well, Senator Scott Flippo, I loved having you on. We did a segment a couple weeks ago where we talked about some big picture conservative stuff, and I was wondering if we could kind of start by thinking about the big picture of this health care debate that's going on right now in Washington, D.C. You're following this, I'm sure, right?
You know, that's a great question, Paul. And you know, obviously, I think that the Republican Party is kind of at a crossroads here, or a stalemate, if you will. And it doesn't seem like there's any kind of headway in either direction on what they're going to do with as far as the repeal of Obamacare and I guess the replacement of Obamacare. And that's a point that I would like to touch on as far as the replacement. You know, it's proven to be very politically treacherous. And this is one of the reasons that I opposed the private option, the Obamacare Medicaid expansion here in Arkansas, was understanding that once you give people something, it's difficult to go back and to take it away. And that we ought to not have done it in the first place for a litany of reasons. And we've had it, you know, for just 3 years now, and the sky's falling and the heavens are collapsing if we do away with Medicaid expansion. And it's going to blow a hole in the budget, and it's going to do all these things. And you know, I'm looking, you know, just this year, we had to scale back Medicaid expansion. And why? Well, now we're starting to pick up 5% of the cost. And that's going to increase to 10% of the cost, you know, in 2020. And that's going to be a big hit to Arkansas's budget. And we're going to have to make some tough decisions. Now, think about that's a big hit here at the state level. And imagine what that hit's going to be at the federal level. The idea that you can provide insurance for 20-something million new people that were previously uninsured and not have the cost, you know, not have that cost the rest of society anything is absurd. If Republicans are going to go out there and say that we're going to keep coverage for Medicaid expansion recipients, able-bodied working-aged adults between 18 and 64, and we're going to provide them with, you know, with free health care and free insurance, and in many cases, there's a copay, but it's very nominal. You know, here in Arkansas, it's about $13 for, you know, a $500-something policy. And we have to look at the costs associated with that. And I hear a lot of the liberal media saying that, you know, well, we're looking to kick grandma and grandpa out of the nursing home, and we're looking to do away with services for that 2-year-old with cerebral palsy. Absolutely not. I think that's who we need to be fighting for, making sure that we are protecting, because we do have that responsibility to these people. But from my own perspective, and I think for a great deal of conservatives, is we have to sit there and make some difficult decisions, and we have to prioritize our needs. And the elderly, the children, they got to rank at the top of that list. And before we can even engage the conversation of, you know, expanding health care to all, why don't we look at what our current obligations were pre-Obamacare and make sure that we have those programs shored up. I don't know anybody that was thinking that Medicaid and Medicare were vastly overfunded and, you know, just humming along at a very efficient rate. You know, there's always a lot of waste, a lot of abuse, and different things that go in. And so why wouldn't we want to address those things before we tackled even more?
You're really making some great points. Again, we're talking with Senator Scott Flippo. You know, the point that you just made about the truly needy is certainly something that I think is overlooked. I mean, in Arkansas, you look at the developmentally disabled, the people who are on that waiting list who can't get care, and yet, like you said, $500 a month per person going to insurance companies. That's how much we're paying. It's a lot of money. And but then we look at the cost. I like what you just said. Basically, if everybody is going to get free health care, it's not really free because somebody's going to have to pay for it. So, from the Washington, D.C. standpoint, what they're debating, it seems like our costs are not going to get cheaper unless we stop giving away so much of it for nothing. And do you think that we're, adults enough to have that conversation? Because I don't really hear that from this debate in D.C. right now.
I don't either, Paul, and I like to think that we are adults enough to have that conversation. And I'll be honest with you, I don't really care where you would fall on the political spectrum. At a certain point, I think that most citizens, be it of this state or of this country, what they'd like to hear from their elected officials is a degree of honesty and candor. And even if that means, giving you news that you would prefer not to hear, I'd rather people be direct and upfront and honest with me and tell me some hard truths instead of skirting around them and trying to sugarcoat them. And I think that's a big part of what's missing in government today at so many different levels is, you don't get elected by telling people, there's going to have to be some pain and sacrifice and some knocks on the chins that we're going to have to endure for the greater good. And it's all about, this is what I'm going to do for you. This is how I'm going to help you. This is how I'm going to benefit you. Well, somebody's got to pay for all of those things. And Republicans need to be very careful that we don't fall into this, liberal ideology. We can somehow go through and get government to provide all these services and do all of these things at no cost to the taxpayer, that we can actually increase spending and cut our revenues. And that's going to somehow be, be viable and stable. It's absurd financial policy. And I don't know anybody that makes that kind of financial decision-making in their personal life or in their business. And I just, for the life of me, I can't figure out why government thinks that they're somehow in a position to do exactly that. That's how you end up with $20 trillion deficit.
Let me ask you this, talking with Senator Scott Flippo, is it a little concerning or maybe disappointing that, we've had in Arkansas a lot of elections on this issue of Obamacare? You specifically, when you ran, Obamacare was a big issue in District 17. Nationally, I mean, it's what turned out the Tea Party and gave the Republicans the House, and then the disaster gave them the Senate, and then, it was a big part of the presidency as well, getting Donald Trump in there. And yet, the entire idea and concept of repeal really comes down to two senators, whichever two senators that it is that just says, hey, we're not going to support this. Is that, it's kind of, I don't know, it's kind of a
concerning.
Shame,
and I'm trying to think the senators from Nebraska's name, I want to say Ben Nelson, and I might be mistaken there.
Sass. You're talking about Sass, right?
No. This was back when Obamacare was being was being debated
Ben Nelson.
during the Obama administration.
Yeah, Nelson. Yeah, you're right.
Ben Nelson. Okay, and he ended up not going through with this, but in order to secure, in efforts to secure his support, was basically the federal government was going to pay for 100% of the cost of Medicaid expansion in Nebraska, and they kind of go off, and that's how they pick you off, is they buy you off. And so you end up supporting things not because you fundamentally agree with it, but because, you might get the better end of the stick. And that benefits you personally or your constituents personally. And I get that. You represent your constituents. But what about everybody else? What about the other 49 states? Could we do that for all states? And that's kind of how politics work. And, as a conservative, I don't think that I can sit around and just think about what are all the ways that government can benefit just me personally. What are responsibilities that I have to make sure that I'm doing as much as I can to help myself, to take care of myself, to help the people in my community? I have a responsibility, to my community, to my colleagues at my business. And what is my responsibility within all of this? And when you get into healthcare, so if somebody would say that healthcare is an absolute right, well, at some point, would it not stand to reason that the conversation shouldn't pivot to, well, if the taxpayers are going to be paying for your health insurance, what responsibilities does the individual have as far as their lifestyle, their decision-making, and things they can be doing on their own to lower their cost of health care? What are preventative measures that they can be taking as far as diet and exercise and other things that can, have a reduction in their health care costs later on in life? I mean, if this is just an absolute right and entitlement, then you can just go off and smoke 2 packs a day and eat Big Macs and drink Mountain Dew and make all these horrible decisions. But, the taxpayers are going to pay for your health care.
Yeah, and that's where I get really worried because, if we buy into the everybody has a right to it, then eventually the financial bill does come due, and then they start trying to infringe on your rights. I mean, the Supreme Court, the precedent is still there. They can force you to buy health insurance, so why can't they force you to eat broccoli instead of bacon? That's where I'm worried we're going.
Absolutely, and that's one of the things that really frustrates me about government is the lack of long-term thinking and seeing that it's not just how it is today, but where's it going to be in 5, 10, 15, and 20 years down the road. And, a lot of times I think elected officials are just, sometimes they make decisions and think, well, I'm not going to be in office when the chickens come home to roost, so it won't be my problem. Mm-hmm. Well, it's all of our problem. And these are decisions that we make today are going to be affecting, future generations for the foreseeable future. So we have that responsibility that we need to not just be looking at the problems of today, but be looking at the problems of tomorrow and the potential that some of this additional spending and and increasing government, what cost is that going to come at? And a whole litany of things, Paul, that I could look at and think. And I was telling somebody the other day, we all know that, that smoking is bad and wearing your seatbelt is a good idea. And, in Arkansas now, they have a law, it's a primary seatbelt law, where, you can be pulled over and given a ticket, $150, $200 ticket for simply not wearing your seatbelt. And it's a good idea to wear your seatbelt. Does government exist to protect you from yourself? I don't think so. And today it's tobacco and seatbelts. Mm-hmm. Tomorrow it's going to be, donuts and life jackets.
Yeah.
It'll never end. There is no defensive line which you do not cross, and we're just going to leave it alone. It's the same thing when I hear liberals talk about common sense gun control. Well, great. Who gets to define what common sense is? And can you assure me that, if we did something that we're never going to come back and touch it again? Mm-hmm. No. What government's going to do is they're going to take what they can get today and then circle back tomorrow and take another crack at it.
Take the rest.
And keep chipping away at our freedoms and our liberty. And they're going to do it under the pretext of making our lives easier.
Yeah, that's exactly
right.
And
that scares me exponentially.
And do we say, yeah, I want an easy life? Do we buy into the lie? Last question, Senator Scott Flippo. So I love what you said about, look where this is going to be 10, 20 years down the road. In Arkansas, kind of bringing this back down to the local level.
Sure.
Several years ago, there were Arkansas politicians, who are in the leadership now that were willing to talk about the path that we are on, which is socialized medicine. Unfortunately,
absolutely,
you look at what's happening with Charlie Gard over there in Great Britain and that family that's being told that their kid cannot get the experimental treatment. They just want to let the kid die. And it's like that's what we used to in Arkansas. We used to talk about that. And then I don't know, maybe they paid us to shut up about it. I mean, that's kind of what it looks like generally. Like, hey, well, we'll just give you this money. Shut up. Don't talk about the pitfalls of socialized medicine. That's really concerning to me, and I wish we could get back to a place where we do talk about the generally why socialized medicine is a terrible idea.
It's a horrible idea, and why is it that the government doesn't just exist just to make your life easier? That's not the purpose and the role of government. The government doesn't exist to protect you from yourself. It exists to make sure that other people aren't infringing upon your rights or any roughshod over you. Not to make sure that you're not making bad decisions, and not just to make sure that your life is as easy as it can possibly be. If you wanted an easy life, I guess it's the right thing to do. Just to never be able to leave your parents' house, just live in the basement, and eat mom's cooking every night, and let her do your laundry, and let dad cut the yard on the weekend. Don't pay any utility bills, and it's going to make for an easy life. But is that the way that life was meant to be lived? No.
Yeah.
And again, the idea, especially that concerns me, Republicans, is that we have to do a much better job of getting out and messaging and talking to our constituents about, Why is it that we're conservatives? Why are these the principles and the values that we believe in? And you know what? Sometimes, yeah, there might not be a personal benefit directly to you, but it's not about you. It's about all of us. It's about the future of this country, making sure that our children, and you are a new dad. You know, you just had a little girl last week, and so you have a newfound appreciation for this, Paul, that making sure that freedoms and liberties are still there for future generations, that we still appreciate and have an appreciation and understanding of what it's like to live in a free country. And, you know, if we continue to water that down as Republicans go along with that, we're not just doing ourselves a disservice or our party a disservice, we're doing constituents a disservice and future generations a disservice. And that's the thing that we need to be out there talking about and impressing upon the people. People are willing to sacrifice. What you have to do is they want to be led by example and not just by rhetoric. And that's got to start with people in elected office. And I think that when you open up the paper and you see about another legislator or congressman that's on the take and got caught with their hand in the cookie jars, it's a difficult pill to swallow to think, and who are you to tell me that I need to, do more with less? And, and I get that. And that's why it bothers me when I see people that, abuse their positions in elective office, because it makes us all look bad. It makes us all look self-serving, and that's not the case. But the challenging part is that we're going to have to visit with our constituents about some things that are not going to be inherently fun conversations, but they're necessary conversations. And if we shirk from that responsibility, then shame on us.
Senator Scott Flippo, big picture conservatism. I always like to talk to you. We'll do it again soon, okay?
Look forward to it, Paul. Thank you very much.
Be safe. Folks, we're going to take a break. Always a great interview. Back in just a moment.